Hi everyone, welcome once again to my YouTube channel. Myself, Dr. Sarika Katkuri, physiotherapist practicing in Mumbai. I hope you all liked my first YouTube video, which was an introduction to physiotherapy. So I thought of making my second video a continuation to the first one. So as I had described earlier, uh, the broad spectrum of conditions covered in physiotherapy and what all conditions you all can visit a physiotherapist for. So let's see today when you all visit a physiotherapist, what is expected to happen in the clinical setup. Um, as most of us have been visiting other doctors since our childhood, we have a brief idea as to what happens there. Like there's a brief checkup of our pulse, our blood pressure, temperature, etc. Some detailed questions, and then we are prescribed medicines or injections. And if something serious, then you probably have to get admitted in the hospital. But when you visit a physiotherapist, the pattern is not very different. The most important part of the examination is the history. History is the detailed questionnaire uh, which is prepared according to the conditions of the patient. So yes, different categories would have different questionnaires and different examination pattern. So let's like I had mentioned last time, let's talk about musculoskeletal pains like spine pains or any other joint pains in the body. And if it's traumatic or non-traumatic, meaning occurred after a trauma or occurred for no reason. So the questionnaire would again change according to that. So the basic thing it includes is the basic details of the patient like name, age, sex, occupation. Occupation forms a very important information for us because that helps us to know what activity is the patient involved in most time of the day and whether that activity or that position has triggered the patient's pain. Then we come on to questionnaire regarding the condition of the patient. Say if he has a shoulder pain or a back pain, so we will ask questions about that and what activities trigger the patient's pain, what activities relieve the patient's pain. Uh, yes, the questionnaire has to be quite in detail, specific to the condition, as it helps us to reach the accurate diagnosis for the patient. Now, once we are done with the history part, then comes on to examination. And before that, a very important aspect is what we term as observation. So, observation can be done in various ways. When the patient walks into your clinic or when the patient is seated and you are talking to the patient, we can minutely observe the patient's style of walking. It many a times indicates us what muscles would be weakened there or what deformity the patient might be having. And when the patient is sitting in front of us, we can judge the patient's posture because he's unaware of that we are observing the patient. So he would be sitting in his usual posture, and we can know if his posture is the problem, is the cause of the problem, right? So this is a minute observation that you can do while you are taking history of the patient. Then comes the examination, clinical examination, which includes in ortho cases, it includes testing the movements of the patient. Say example, you have a shoulder pain, so we would be testing your shoulder movements in all the directions to know which movement increases your pain and which movement is restricted. um, we usually also check the joints which are proximal and distal. That is, example, if you have a shoulder pain, we would also check your cervical spine and probably the joints below the shoulder too. After you check the movements, you go on to strength. Strength is very important. Many a times, because of pain, acute pain, the strength of the patient goes down. The strength of the muscles around that particular joint reduces. So we have to know that so that our treatment is aligned accordingly. Then comes very important part is the sensations. in many of the spine cases, where the pain radiates down from neck to the hand below, or sometimes to the shoulder only. Uh, Many patients complain that they have some altered sensations in their hand. Either they've gone down or they feel it differently, some kind of tingling. So it's very important to know if their sensations have been altered. And that also, why is all this examination and history important? Because that those are the prognostic factors, meaning when the patient recovers, these are the baselines. So if the patient's strength improves, if the sensations get better, if the functional activities improve, so we know that the patient is recovering. So these are the very important baselines which need to be checked in every session that the patient visits us. um, so these were the detailed examinations that you can carry out in your clinical setup. And once you are done with the history and examination and you have formed a provisional diagnosis, you can now start the treatment. The treatment is mainly focused around giving such movements or exercises to the patient which would reduce the patient's pain. And many a times in extremity cases like a shoulder pain, you would first screen out the spine, that you would start some spinal exercises first and see if those help to reduce the patient's pain, and only then move on to the shoulder exercise. So yes, in initial few settings, you do not want to trigger the patient's pain, you want to reduce it. So you would focus on giving those exercises which would uh, relieve the patient's pain. A very important part of the treatment includes the posture. Like I said, we have to be very observant of the way the patient is seating, his normal posture. So we have to train him for attaining a good posture at work and at home, because that influences a lot of our spine and joint pains. Uh, so that was mainly about orthopedic uh, examination and treatment. What if a neuro case, like a neurological patient, example, a brain stroke, who is probably paralyzed on one side or both sides of the body? What examination you would carry out in that case? So your examination includes a lot of things, like the patient's voluntary control, that is the patient able to move his extremities, and if yes, is he moving it in the correct pattern? Then we would also check the tone of the muscles. Are the muscles too tight or are they too loose? So it helps us to know whether the patient needs to be stretched or the patient needs to be strengthened. Again, here the muscle power, sensations play a very important role again. Reflexes of the patient are very important in neurological cases, because some reflexes which are supposed to be negative are positive. If some reflex is positive, we know that this patient does have a neurological condition. So again, like I said, these examinations, these tests have to be done in every session, so that we know how well are we recovering or how well is the patient progressing. Again, after that, a very important thing in neuro case is the coordination and balance. So coordination usually involves the fine movements, or even large movements, but like you would have seen in neuro cases, sometimes the patient may not be well coordinated. He may not be even able to drink a glass of water. So we need to train the patient to perform those simple tasks, and that requires a great deal of coordination and fine movements. Then comes the balance part, wherein you check the patient's balance in standing, in sitting, in walking, and if it's affected, we train the patient accordingly. So based on your examinations, you would treat, like I said, uh, if the muscle is tight, you would stretch it. If it's weak, we would want to strengthen it through various activities and positions. If the balance is affected, we show balance exercises, we train the patient's balance. and so on. Yes, during these treatments we make use of lot of equipments also, like vestibular balls, therabands, weight cuffs, cycle, etc. So there are a lot of equipments you can use for your treatment purpose. So that was about neuro. About cardiorespiratory, like I had mentioned earlier, if there's a bypass operation has taken place and you visit a patient in the hospital, um, the questionnaire, the history would again be according to the patient's condition. Very important thing if the patient in the hospital and in the ICU is to monitor the patient's vitals. Vitals includes the patient's blood pressure, the pulse rate, temperature, and the respiratory rate. Very important. Also the SpO2, which is the blood oxygen levels. Only if the vitals are stable, we can proceed with our treatment safely, and if not, we need to consult to the concerned doctor and then go ahead with the treatment. After we have checked the vitals, we can now check, auscultate the patient, very important. Uh, Using a stethoscope, we would try to find out how is the air entry of the patient in the lungs. Is the patient breathing well, or is the air entry reduced in some parts of the lungs? Also, we would try and find out how is the coughing. What we call as crepitus is actually the cough mucus that is present in the lungs, and we can often hear it on the stethoscope. So, and why is that important? Because once we know where the air entry is reduced or where the cough is present, our treatment can be directed towards those areas. So if we know a cough is present in a particular part of your chest, in a particular part of the lung, we can give them chest physiotherapy over there. Uh, and chest physiotherapy would now include of techniques which would help patient to expel the cough out. Also, it includes a lot of breathing exercises, which could be inspiratory or expiratory, or a combination of both. Again, we can make use of equipment like spirometers for training the patient to breathe deeply. And it also includes patient's functional activity, like we would train the patient to get out of the bed, uh, probably help him to use a commode, also walk him around the corridor. So this all will be done in supervision. If it will be good if some doctor or nurse is present along with the patient. So guys, this was the brief video for today. As I wanted to cover what all you can expect when you visit a physiotherapist, what all examination includes, and what all treatments are given. I hope that was helpful again, and have a good week.